with us the gem of Indian homeopathy, Professor Dr. Ashok Kumar Das, sir. Last week's session was truly exceptional. Sir has provided profound insights. His expertise and engaging delivering made this session both informative and inspiring. We are grateful for your contribution and the valuable knowledge you have shared with us. From a student's perspective, last week's session was incredibly enriching and truly enhanced our learning experience. Before we dive into today's session, let me briefly recap our session from last week. We explored topic miasm, type of miasm, and stages of miasm, which provide valuable insights. It was a productive discussion, and I hope you found it as enlightening as I did. If you have any follow-up queries, please feel free to bring them up after our discussion today. It's over to you, sir. Dr.
Okay.
Ashok Kumar Das, sir.
Okay. So go to the slides. Can you see my slides?
Yes, sir.
Yes. Good afternoon to everybody.
Dr. Vishal.
In continuation to my last lecture regarding how the concept of miasm has developed and the development of SORA, a non-venereal miasm, today I want to discuss on the manifestation of the three miasms at their different stages. In my last lecture, I discussed the development of SORA, where I have discussed the mode of infection, internal development, followed by external manifestations, where at first there is primary manifestations, followed by the latent state, followed by the secondary manifestations. Now, all these stages are almost similarly applicable in relation to the other venereal miasm, that is psychosis and syphilis. So, if you think of the stages of manifestation of miasms, there is primary manifestations, latent state, followed by secondary manifestations. Today, I want to discuss the psychotic miasm, one of the most important venereal miasm. The development of the primary manifestation of psychosis through gonorrheal infection during coition. The psychotic miasm enters into our body, and after entry of this miasm, it pervades the whole human system, and after several days or several weeks, it develops certain excrescences locally, along with a sort of gonorrheal discharge from the urethra. So first, there is infection with gonorrhea through coition, then entry of the miasm into the body, then complete internal development during several days or several weeks, followed by manifestations of certain excrescences locally, and most of the time it is usually associated with some gonorrheal discharge from the urethra. And these excrescences are the primary manifestation of psychosis. Now, what's the character of the excrescences? They are usually soft, spongy, with fetid fluid coming out of that, bleeding easily, and looks like coxcomb or a cauliflower. They are rarely dry, like words. So that cauliflower-like growth or excrescences, which is soft and spongy, which bleeds easily, with fetid discharge, watery discharge, is the primary manifestation of psychosis developed after impure coition when a person being affected by gonorrhea. Now, what's the distribution of those primary manifestations? In case of males, they are on glands and below the prepuce. In women, they are on the pudenda and surrounding areas. So this is the primary manifestations. Now, these primary manifestations of psychosis, when treated by the allopathic physicians externally, by cauterizing, burning, or cutting, or by ligatures, they usually again appear, which again is subjected to similar treatment of cauterization, burning, cutting, or by ligatures. Being deprived of the local symptoms, then nature tries to throw this disease through secondary ailments. So the primary manifestation of psychosis, when suppressed by some external treatment, that leads to the development of secondary manifestations. In this regard, I must mention here that in between that, there is a latent state. But this latent state of psychosis was not mentioned by Hahnemann. It is Dr. J.H. Allen, in his book of chronic miasm, he discussed that in between the primary manifestation and the secondary manifestation, there is a state of latent psychosis. As I told you in relation to the Sora, that Sora remained in a latent state whenever the life situation is unfavorable, there is no exciting and maintaining cause, the Sora remain in latent state, but whenever the same person is being exposed to some exciting or maintaining cause, then the latent Sora develops to produce manifested psoric chronic disease. Likewise, here also, after the removal by external means of the psychotic primary manifestations, the psychosis remain in a latent state during some favorable life condition of the patient or person, but whenever exposed to some exciting and or maintaining cause, that leads to development of secondary manifestation of psychosis. So this is in short the development of psychosis. Now, in addition to the development of the syphilitic miasm, infection with syphilis through impure coition, followed by appearance of venereal chancre, usually between 7th to 14th day, mostly on the membrane of the genitals infected with the miasma. That means usually within 7 to 14 days of the impure coition, this primary manifestation of syphilis develops as venereal chancre. Now, so long this venereal chancre remain in that place, there is no other secondary manifestations. If it is not cured, it remains on the same place during man's lifetime, only increasing with the years. But the secondary manifestations develops as long as will not develop as long as it exists. Whenever the primary manifestation of syphilis is externally treated and suppressed, that leads to development of secondary manifestations. Now, as regards the concept of latent syphilis, Hahnemann do not say about latent syphilis. It is also Dr. J.H. Allen. He mentioned that in between the primary manifestation and secondary manifestation of syphilitic miasm, like that of psychosis and SORA, there is a state of latent syphilis, like that of psychosis and SORA. And whenever the patient is subject to similar external treatment, that leads to the secondary manifestations. But again, you must keep in mind that in between the development of Sankar and the secondary manifestations, there is another manifestation comes. That is, the destruction of the Sankar leads to the development of more painful substitute, the vivo. That means Sankar treated by some external means, then nature substitutes by some painful bubo, and that painful bubo again subjected to similar external treatment, followed by the secondary manifestations. So if you think of the primary manifestation of syphilis, you have to think of the syphilitic excrescences followed by development of painful bubo. So both are under primary manifestations. Now, whenever that primary manifestations, that driving out of this bubo to the injurious treatment of allopathy, that will lead to the development of secondary manifestations of syphilis. So, in case of syphilis, there is venereal Sankar, suppression, followed by development of bubo. That bubo is again subject to the similar external treatment, followed by the secondary manifestations of syphilis. This is Hahnemannian concept. As regards J.H. Allen is concerned, in between the primary manifestation and the secondary manifestation, there is another state, that is the latent state of syphilis, like that of psychosis, like that of SORA. So, if you think of, or if you summarize the whole thing, you see that you have to understand the primary manifestation of SORA, psychosis, and syphilis. Then you need to understand the manifestations during latent state, either SORA, psychosis, or syphilis. Likewise, at last, you have to understand the secondary manifestations, that is SORA, psychosis, and syphilis. So, if you want to understand miasm through its manifestations, you have to know all the manifestations under three broad categories. That is primary manifestations, manifestations during latent state, and manifestation during secondary stage. So first I want to discuss this. I already discussed about the primary manifestation of SORA, syphilis, and psychosis. Today I will discuss about the latent symptoms or latent state of miasms of SORA, syphilis, and psychosis, and ultimately the secondary manifestations of all the three miasms. So these are the basic theoretical understanding of miasm. After that, in the next classes, I will discuss about the practical application of this theoretical knowledge in actual clinical practice. So let us start with the latent state of miasm, that is primary manifestation, SORA, that I have already discussed. I have already discussed all those things. Development of secondary manifestation. I also want to give much emphasis on unfavorable conditions of life as exciting cause. Today, I want to focus on that aspect more. Now, whenever a patient comes present in a latent state, whenever a particular miasm remains in a latent state, any exciting cause may cause to convert the latent state to the secondary manifestations. So we must know what are those unfavorable conditions which may act as an exciting cause. The first of all, a prevalent epidemic disease. Like for example, a patient has a latent SORA. The patient suffers from certain epidemic disease. After that epidemic disease, patient develops so many different types of chronic complaints. A very good example, all of you know, in the recent past, the epidemic of COVID-19. In those persons where the patients have latent SORA, where the SORA remain in a dormant stage, then the patient suffers from COVID-19. And after that, the patient suffers from diabetes mellitus, the patient suffers from dyspnea, allergic manifestations, even heart attack, so many different types of diseases develops after suffering from an epidemic disease. So please say that what Hahnemann told 200 years back, it is also prevalent at the present time. We have seen in the last epidemic of COVID-19 that how different type of chronic diseases develops in persons who have latent SORA in their body. So many a times we have seen in the name of long COVID, in the name of the manifestations or chronic manifestations of COVID-19. Next, any infectious acute disease. Yes, not only COVID-19, it may, as it is an epidemic, it may be another infectious acute disease. It may be an individual type or epidemic type. Next, external severe lesion like a fall, a wound, a considerable burn. That means any injury which undermine the state of health. Please keep in mind that any condition, Hahnemann given these examples. So any factor, any condition which may undermine the state of health, that may lead to conversion of latent state to manifested state. Next, heart level. Heart level, you see, we always say that as a healthy person, we must maintain a good lifestyle. There is a need of rest, sleep, adequate diet. But if you overwork, you are doing lot of work day and night without food, irregular food, then also it undermine the health, and that may cause the conversion of latent miasm to the manifested disease. Next, confinement due to disease with allopathic treatment. You are suffering from certain acute disease, then treated by allopathic means, some acute disease, it is a self-limiting disease. You do allopathic treatment, it removes or palliates the symptoms, but the patient suffers from loss of appetite, weakness, lethargy, and ultimately the latent miasm may manifested in secondary manifestations. Whatever I have mentioned here, this is not my examples. This is the examples written by Dr. Hahnemann in his book on chronic diseases. that I am just discussing one by one. Confinement due to sedentary occupation in a gloomy closed room. Please say sedentary habits. And working in a gloomy closed room, it needs a room where you work sufficient amount of oxygen, air, light, everything. But if you don't follow that one, that may cause also as an exciting cause. Grief due to sad losses of beloved ones. Not only the physical factors, the mind is also important in the development of secondary manifestations. Now, the grief, mental shock, continuous stress and strain, everything, the mental factors are also responsible for conversion of the latent miasm to the manifested disease. Daily vexation and annoyance which embitter the life. Deterioration of the food or entire want of what is necessary and indispensable. Exposure to inferior food, beating down man's courage and strength. Please keep in mind that all those examples are nothing but anything which are against our health lifestyle. That may cause an exciting cause. You need adequate amount of food. You need adequate nutrients like carbohydrate, protein, fat, minerals, vitamins. So if you are deficient in any of them, that undermine your health, which triggers the latent miasm to convert into secondary manifestations. So, to prevent disease in homeopathy also, we need to maintain a healthy lifestyle and habits. That we should keep in mind that still Hahnemann is relevant in the present context. You see, what Hahnemann told 200 years back regarding the development of the different diseases, regarding the exciting cause and maintaining cause, you see, the modern science also says the same thing. That means Hahnemann's concept of disease, development of the chronic disease is still relevant in the present context. With this background, let us discuss about the symptoms of latent psora. I will just want to emphasize all those symptoms of the latent psora from head to foot so that you can easily recognize in your patient. Head symptoms: frequent one-sided headache, even from moderate emotional disturbance. Slight emotional disturbance causes headache, which is one-sided. Frequent falling of hairs of head with dryness and many scales upon the scalp. Dryness of skin is a very characteristic symptom of the latent psora. There, not only there will be falling of hairs, but the scalp will be dry with many scales. Perspiration on the head in evening and going to sleep. In fact, in case of latent psora, the patient is otherwise healthy. You cannot diagnose exactly from which disease the patient is suffering from. But only some types of symptoms come here and there. Their nosology fails to diagnose. But here, by this, all those symptoms, you can diagnose that the SORA is in the latent state in the patient. The person suffers frequently from inflammation of eyes. The person frequently suffers epistaxis, and it is more common in case of girls and youths. Very severe type of epistaxis with girls and youths, but rarely in older. The patient suffers frequently from dry or fluent coragia or catarrh, or some extreme may happen that there is no, the person do not catch cold even from the most severe cold exposure. So both are possible. Extreme, there is no susceptibility to cold, extreme non-susceptibility to cold, or there may be frequent dry and fluent coragia or cataract. The long continued obstruction of one or both nostrils, the ulcerated nostrils, disagreeable sensations or dryness in the nose. So many symptoms are there in relation to the nose. As regards face, frequent flushing of heat and redness of the face with anxiety. Whenever the patient suffers from some anxiety, there is frequent flushing of heat and redness. The patient predisposed to erysipelas now and then. So patient frequently suffers from erysipelas skin eruptions. As regards tongue is white, at least very pale, with cracking. So frequently there is cracking of the tongue, bad smell in the mouth, frequently or most constantly, especially at morning and during menses. Sour taste in the mouth. Patient often suffers from sour taste. Patient will complain, or person will complain sour taste in the mouth. Next, dryness in the mouth at night or in the morning. So I told you earlier that dryness is the characteristic symptoms of the psoriatic miasm. As regards throat, much phlegm in the throat. Frequent inflammation of the throat with hoarseness. The patient suffers from, either it may be suffering from inflammation of the throat with hoarseness. Swelling of cervical glands. The cervical lymph nodes are enlarged. The otherwise known as the scrofula, the scrofula and SORA. So swelling of cervical lymph nodes. Regarding desire and aversion, there is intense disgust to cooked warm food, especially meat, especially in children. The children don't like warm food and meat. What happened? We have seen children usually likes meat. Those who are non-vegetarian, but there the patient has aversion to meat, aversion to warm food, and also extreme disgust to milk. Don't like to drink milk. Hunger, very important. Now, insatiable hunger, then again want of appetite. The changeable appetite. Now, very much hungry, followed by no hunger. As regards stomach, nausea at the morning and sensation of emptiness in the stomach. All sensation we'll see are psoriatic in nature. So sensation of emptiness in the stomach, the nausea in the morning, that all indicates SORA in latent state. As regards abdomen, there are cutting pain in the abdomen, frequently or daily. In children, more frequently at morning. The child frequently suffers from cutting pain in abdomen, usually at morning time. Distended abdomen, frequent discharge of ascarides and other worms, mostly with children. The children who possess worms, who suffers from itching of rectum frequently due to worms, they are latent sora, and that to be considered. As regards bowels and rectum, insufferable itching of rectum caused by worms. I told you just that there is passing of worms with stool, and at the same time, the itching of rectum, that is the symptoms of latent sora. Patient may, or the person may have hard stool, delaying usually more than a day. Stool is not regular, 1 day interval, 2 day interval, often covered with mucus, or nearly always with soft fermenting stools like diarrhea. So both may be there. There may be mucus stool with diarrheic stool, or there may be hard stool and constipation, not a regular stool. That are all the symptoms of latent sora. Venous knots in the anus, passage of blood with the stool. Yes, often patients suffer like piles, the passage of blood in the stools. Passing of mucus from the anus, with or without feces. That may be involuntary passage of mucus with stool, without stool. And itching of anus, I already told you earlier. The urinary organs, urine is the dark, and the patient frequently suffers from dyspnea. The skin is very important. Unhealthy skin. Every little lesion passes into sores. Whenever there is little injury, that leads to ulceration. Cracked skin of the hands and of the lower lips. Cracked skin, unhealthy skin, frequent boils, frequent phelons. Dry skin of the limbs, on the arms, the thighs, and also the times on the cheeks. So please keep in mind the dry skin, unhealthy skin, cracked skin, they are all the symptoms of latent sora. Here and there is a rough scaling spot on the skin, which causes at times a voluptuous itching, and after rubbing, a burning sensation. Please keep in mind, psoriatic skin symptoms. There is a voluptuous itching, followed by scratching, followed by severe burning. So, itching, scratching, followed by burning, that is the symptoms of latent sora. It is also present, I'll show you in the manifested sora also. But please keep in mind, to diagnose sora, this particular character of the skin disease is very, very important. Severe voluptuous itching, followed by scratching, which leads to severe burning. Next, predisposition to erysipelas, here and there. What is erysipelas? This is an acute, sometimes recurrent disease characterized by large, raised, red patches on the skin. So, red, raised patches on the skin is nothing but erysipelas. The patient often suffers from this type of skin eruptions. Swollen, enlarged vein on the legs. It is very commonly you have seen these veins are enlarged on the legs. Again, the person develops frequently chilblains and pain as from chilblains. What is chilblain? a painful itching, swelling on skin due to poor circulation in the skin whenever exposed to cold. So cold exposure leads to the development of a painful itching swelling is known as chilblains. The psoriatic or patients having latent psora tends to develop more frequently this type of skin eruption whenever exposed to cold. So tendency to chilblains, tendency to develop erysipelas, tendency to develop different types of skin disease with severe itching, scratching, and burning. They are the general characteristics of the psoriatic psora in its latent state. Next, pains as of corns without any external pinching of the sole. That means the sole is very painful, like that of corns. Now, the symptoms of upper and lower extremities. Usually, cold hands or perspiration on the palms. There may also be burning of the palm, cold, dry, or ill-smelling sweaty feet. So, cold feet with fetid odor. There may be also burning of the sole and feet. The arms of the hands and legs and feet are benumbed by slight cause. Benumbed means loss of sense. Doctor, I often suffer from numbness of my legs or feet with slight cause. There is no other complaint. Then you have to think of, yes, the patient has psora in its latent state. Another one, frequent cramps in the calves, the muscles of the arms and hands. The tendency to the cramp, very often you will see in your practice, the patient will say, doctor, at night, all on a sudden I feel pain in the calves due to cramps, crampy pain on the calves at night. They are also the symptoms of latent psora. The twitching of the limbs on going to sleep. Whenever person goes to sleep, the patient suffers from twitching of limbs. Crackling of one or more joints on moving. Whenever any joint moves, cracking sounds develops. Drawing, tensive pains in the neck, the back, the limbs, especially also in the teeth. In damp, stormy weather, in northwest and northeast winds, after colds, overlifting, disagreeable emotions. You see, lot of exciting factors. In damp, stormy weather, in cold exposure, disagreeable emotions, overlifting, overexertion, all lead to drawing, tensive pain in the neck and the back and the limbs. They are nothing but the symptoms of latent psora. As regards female sexual sphere, the patient or person suffers from amenorrhea, different types of irregularities in the mens. Different types maybe. It may be too copious, too scanty, too early, too late, too long duration, too watery. That means various types of irregular menses connected with various bodily ailments. That is important. It may have amenorrhea, or there may be different types of irregular mens associated with various physical problems. Now sleep, twitching of the limbs on going to sleep, weariness early on awakening, unrefreshing sleep. What happens? Usually, we feel fresh after sleep, but the patient of latent soda, they feel unrefreshed sleep even after good sleep. So, twitching of the limb, unrefreshed sleep, they are all the symptoms of latent soda. Now, what about the different generalities? Most of the ailments come on at night. Please keep in mind, I always think that syphilis aggravation at night. But some symptoms of soda also, you'll see that there is aggravation at night. And are increased by low barometer. Low barometer means where the barometric pressure is low. Where the barometric pressure is low? In high altitude, cloudy and rainy weather, the barometer pressure is low. So latent soda aggravates with a low barometer. That means aggravates at high altitude during cloudy and rainy weather with north and northeast winds, aggravation in winter and towards spring. Aggravation in winter, aggravation in spring. That is the very characteristics of that is characteristics of latent soda. But some symptoms are aggravation at night, even in cloudy weather and high altitude. So there are certain symptoms which are common to both different miasms. We have to differentiate to the different other symptoms. The predisposition to catch cold, tendency to catch cold, either in the whole body or only in the head, the throat, the breast, the abdomen, the feet in a drought, usually when these parts are inclined to perspiration. The patient have a tendency to take cold or catch cold as a whole. There may be cough and cold, there may be watering from the nose, it may so happen, or it may attack the particular part. Suppose after exposure to cold, the patient develops headache, the patient develops sore throat, the patient develops mastalgia, pain in the breast. So the tendency to catch cold may be as a whole or the particular part, especially whenever they have whenever the parts are inclined to perspiration. That means you are walking or you're running, there is severe perspiration or severe sweat comes up, all of a sudden you exposed to some acute cold. So there is perspiration, suppressed perspiration may lead to catch cold either as a whole or the particular parts of the body. And other sometimes long continued ailments arising therefrom. Yes, that after exposure to cold, the patient suffers from so many other long continued complaints. Now, predisposition to strengths. We say, I told you the tendency to catch cold. Now, tendency to strengths. Strength means even from carrying or lifting a slight weight, often caused even by stretching upwards and reaching out the arms to objects which are hung high. So also multitude of the complaint resulting from a moderate stretching of the muscles. So moderate stretching of the muscles leads to so many complaints like headache, like nausea, like frustration, like tensive pain in the muscles of the neck and back. That means whenever you there is slight stretching of the muscles. Suppose I want to lift certain weight. The weight is not so much big one, but after lifting the slight weight, I suffers from backache. After reaching to some distant objects, there is stretching of my muscles, and that stretching, slightest stretching, leads to severe body ache. So all tendency to affected by slight strains are the symptoms of latent soda. Now, these are all the symptoms of latent soda. Actually, I give much emphasis of this latent soda because I will show you that what the importance of these latent symptoms I will discuss at last. So these are all about the symptoms of latent soda. Now I am shifting to the manifestations of latent psychosis. I told you earlier the latent soda is the concept of animal, but the concept of latent psychosis, the concept of latent syphilis are not by animal. They're the concept of J.A. Challenge. What are the symptoms of latent psychosis? Anemia, rheumatic diathesis. What is diathesis? It is a peculiar tendency to be affected by certain disease. Rheumatic diathesis. Whenever exposed to some cold, the patient suffers from rheumatic problems. You know, hemorrhagic diathesis. This is not psychosis, just to explain the diathesis. Hemorrhagic diathesis. Slight wound leads to profound bleeding. So it is the tendency to be affected by particular disease. Yet the person is being easily affected or easily produce rheumatic complaints following cold exposure or any other exciting factor. Warts, warts, watery growths or moles. Very slow recovery. Whenever exposed to some slight cold, the patient has cough and cold, not so much severe to produce that it is a bronchitis, but still to recover from the slight cold, it takes a lot of time, and that is nothing but latent psychosis. What about the mind? The patient is suspicious, jealous, cruel, restless. I don't want to discuss one by one because it will take a lot of time. That's why I just read out all this. You know what is suspicious, jealous, cruel, restless. Patient has fixed ideas and loss of recent memory with intact past memory. The past memory will remain, but there will be loss of recent memory, that is latent psychosis. Intolerance to spices, wines and meat. This patient can't tolerate intolerance. Please, you must know the difference between desire, aversion, and intolerance. Intolerance means whenever the person takes certain food, that leads to different types of ailments. It may be diarrhea, it may be headache, so many, maybe different types. So this is intolerance. When the patient can't tolerate spices, wines, and meat. Complaints aggravated in humid weather. Complaints aggravates in humid weather. Walking or light exercise ameliorates. Say amelioration by movement, like walking, light exercise, psychotic. Ameliorated by unnatural discharges, Please keep in mind, I will say soda relieved by natural discharges. Here, amelioration by unnatural discharges like leukorrhea, like hemorrhage. So they are all unnatural discharge, which is green or greenish yellow in color. Baldness in circular spots. Baldness means there is falling of hairs within a specific part, circular spots, they are latent psychosis. Redness of nose, only the nose is red, that is psychosis, latent psychosis. Thick, ridged, and corrugated nails. You could just see the nails of the person, it is thick and ridged and corrugated. Now, this is all about the symptoms of latent psychosis. Now, I will switch over to manifestation of latent syphilis. And like that of earlier one, this concept is not the concept of Hannibal, but the concept of J.H. Allen. The latent syphilis, profound sadness. The patient is very, very depressed. That is the symptoms of latent syphilis. Closed mouth fellow. Please keep in mind, this is very important. Closed mouth fellow. Tendency to suppress, wants to conceal everything, even does not want to express his own suffering. Syphilitic patient, whenever you take the case, you'll see he'll say only one or two words. He will not express his mind by narrating all those symptoms. Contrary to soda, a soda patient is very much anxious, go on giving pages and pages of symptoms, which may have certain basis or may not have certain basis. But in case of syphilis, they will close mouth. They will not express their feelings. So, to collect symptoms from a syphilitic patient, from homeopathic point of view, sometimes becomes difficult. So they are closed mouth fellow. They are introvert, wants to be alone, does not like company. Introvert, always remains within, do not want to disclose his feelings, his sufferings, so remain alone. That is the symptoms of syphilis. The strong suicidal tendency with loathing of life. And he actually commits suicide without any information. All of a sudden, the patient suicides. Fixed idea. You see fixed idea also in psychosis, but we need to differentiate with other symptoms. Next, difficulty in comprehension, memory weak. The person is dull, forgetful, memory weak, not intelligent. In context to the sodic, who is bright, alert, restless. So here, syphilis patient lacks comprehension, dull, memory weak, forgetful. Complaints aggravates at night, heat, relief by cold. So relief by cold, aggravation at night, aggravation, heat are the symptoms of latent syphilis. Craving for sour. sweet, chalk, lime, pencil, and wine. Different undigestible foodstuffs. The person has certain cravings. That is the symptoms of latent syphilis. The complete aversion to meat. Don't like meat. Syphilitic or latent syphilis. Falling of hairs in branches. So, falling of hair in branches, they are syphilis. Dandruff with thick yellow crust. The patient has dandruff on the scalp with thick yellow crust. Another thing, the ear and head larger in comparison to body. Mere the appearance of face of a syphilitic person, as a homeopathic physician, you can also diagnose. Ear and head is larger than that of the body. Depressed nose, flat or depressed nose. So if you just look at the face of a syphilitic person, you will see head are large, ears are large than that of the body, and there is depressed or flat nose. Spoon surface or paper thin nails. Diminution or loss of sense of smell. Yes, destruction, loss of sense of smell is syphilis. Now, these are all what so far I have discussed are the symptoms of latent miasms. I discussed psora, syphilis, and psychosis. Now, what is the clinical importance of symptoms of latent miasm while treating chronic cases? Gradually, I will switch over that how, in the background of this theoretical knowledge, we will ultimately treat the patient. Because whatever we learn theoretically, that needs to be practiced while treating the patient. So far I have discussed that why we need to know all those latent symptoms. Because those symptoms provides indications for a curative remedy. The constitutional symptoms are developed from the latent state of the dominating mass. Here I add one new word, dominating mass. Dominating means we have found that a patient may have only one miasm. There may be psora, only syphilis, or only psychosis. But there may be some situation where more than one miasm may be present, like psora syphilis, psora psychosis, or all the three, psora, syphilis, psychosis. So, whenever there is only one miasm, that is the no problem. But whenever more than one miasm is present, it has been found that one miasm will be dominant and another miasm remain dormant. Now, why? If you have the knowledge of organelle medicine, we know when two dissimilar diseases meet together. So, whenever the patient suffers from two miasms, that means patient have symptoms which are dissimilar, one from one miasm, another from another miasm. So, suppose psora and psychosis. So, psora had certain symptoms, psychosis has certain symptoms, but those symptoms are dissimilar. So, what we know that the stronger dissimilar disease will suspend the weaker dissimilar disease. So, psoric symptoms usually becomes very dominant, it for the time being makes the psychotic symptoms dormant. Okay? Now the patient will give more of the sonic symptoms. So that is the dominating miasm. So dominating constitutional symptoms are developed from the latent state of the dominating miasm. So all those different symptoms that come from constitutional symptoms. I will discuss what are those constitutional symptoms are the manifestation of latent miasm. All the finer symptoms of the chronic case, like the mental and intellectual symptoms, the desire, aversions, reactions of the patient in the environment, thermal reactions. In one word, the symptoms of the patient as a person, the non-pathognomic symptoms are nothing but the symptoms of the developed from latent miasmatic state and persisting even with secondary or developed state. Again, I want to clarify this part. What I want to say, what's in our concept in homeopathy, that any problem? Hello? Hello?
Hello. Yes,
Yes,
sir.
yes, share it.
सर स्लाइड नहीं शेयर है अभी आ नहीं रहा स्लाइड
So you manage from your side?
वन सेकंड सर आई एम चेकिंग
Yes, yes, it's right. Okay. Can you see? Go downwards. Not only that, we have to prescribe on the basis of the non-pathognomonic symptoms. And those non-pathognomonic symptoms are developed from the miasm. That's why I again read out all the finer symptoms of the chronic cases. That means the mental and intellectual symptoms, the desires and aversion, reactions of the patient to his environment, thermal reactions. In other words, the patient as a person, that is the non-pathognomonic symptoms, are nothing but the symptoms developed from latent miasmatic state and persisting with even with the secondary symptoms. So whenever we take the case, we have to find out the characteristic symptoms where we'll get the latent symptoms of different miasms. Not only that, in section 95, you know the lesser accessory symptoms. The lesser accessory symptoms, which Hahnemann emphasized much to take into consideration while treating chronic case, as they are the expression of the latent miasmatic state. What is lesser accessory symptoms? The symptoms through which the patient is so much habituated for a long time that they do not pay heed to those symptoms. As for example, just waking from sleep, the person has to go to toilet. So these symptoms or the urging for stool leads the patient to the bed. The urging of the stool that leads the person to go to the toilet. This is habituated. The person is habituated for a long time. We don't think that this is a part of the symptoms. But these lesser accessory symptoms are important in homeopathic prescription, especially in case of chronic cases. These lesser accessory symptoms are the manifestations of latent myasthenia. So with this background, let us switch over to the secondary manifestations of SORA. The time is limited. That's why I will only here discuss about the most characteristic features of three miasms: SORA, syphilis, and psychosis. The mind, the psoric patient is here the patient. Secondary manifestation means they are already patient, they're bright, active, quick, easily fatigued, both mentally and physically. Heat of the whole body after mental exertion. That means slight excitement, slight anxiety produces hotness of the whole body, that is SORA. Never satisfied, fault finder, never well, yet quite unable to locate their ailments. The psoric patient go on giving symptoms pages after pages. But if you pathologically test it, you will see nothing is there. So they are imaginative symptoms. They are that particular symptoms without any pathological basis. They are very, very important. They are never satisfied. Restless, restless in thought, restless in action. The patient, psoric patient is very restless, both in thought and action. Different types of fears: fear of death, fear of disease, fear of incurable disease, fear the case is hopeless, fears and ordinary ailments, things that something serious would come of it. There is a particular boil, the patient thinks that it will be a cancer. So that excessive anxiety, excessive fear are nothing but sorry. He fears darkness, he fears to be alone, fears what will happen in the future, fear of labor. The psoric patient is lazy, don't want to work. So many types of fear. The patient is anxious, so anxiety, and that anxiety much appeared around full moon and at the approach of menses. The patient is irritable. The patient is, whenever the patient becomes angry, he trembles with rage when it over and they deadly prostrated and oversick. The patient becomes angry, trembling with rage, followed by great prostration. The patient gets sick after anger. Sorry. Sensitive to many impressions. Really sensitive to noise, sensitive to odor. Various sensitivity is related to SORA. Highly sensitive patient, sudden changeable mood, pulsations and feeling of constriction about different parts of the body. I told you all types of sensations which without any pathological basis, they are sorry. Mental delusions of all kinds, all types of delusions are sorry. What about physical generations? Functional disturbances, unless combined with one of the other. That means a pure psoric patient present only functional disturbances. But if it is complicated with certain other miasms like psychosis or syphilis, that leads to different types of symptoms. That only psoric symptoms or only psoric patient produce functional disturbances. All kinds of functional complaints when arising from emotional disturbances, any emotional grief, anxiety, loss of beloved one, or any other type of disturbance that leads to functional complaints, that is SORA. Next, physical general functional disturbance. Can't stand still. The patient must walk or lean against something if he is on the feet, like that of sulfur. He can't stand still. You need certain support. Next, weak and debilitated, easily fatigued. All complaints are aggravated in winter, relieved in summer and by heat. Please keep in mind, aggravation in winter, relief in summer, and by heat is sorry. Desire for hot food and meats. Desire for hot food and meats. Hands and feet burn, flashes of heat, especially over face. Coldness in most areas. Skin dry, unwashed, appearing with numerous eruptions, itching skin with burning, itching skin with scratching and burning, that is sorry. So this is in a nutshell about the psoriatic symptoms. What about the characteristics of psychotic patient? Suspicious, jealous, quarrelsome, harm others, cruel, cunning, deceitful, mischievous. That means all bad type of people, they are psychotic. Secretive, anxious, fixed ideas, tendency to suicide, but fears. The difference between syphilis, the patient thinks suicide and done. But here, the patient always thinks of suicide, but he fears to do suicide. Irritable, cross, with fits of anger, self-condemnation, absent-minded, forgetful, confused, slow mental power. All mental conditions better on reappearance of a discharge or elimination. Or the patient feels better on the appearance of the discharge, any discharge or other elimination that relieves. It usually affects the serous and fibrous tissue and mucocutaneous junctions. Tendency to develop rheumatic conditions, slowness of recovery, general relief from discharges. So these are all the general discharges that gives relief. Greenish or yellow, greenish color, and fish brine odor of all discharges. So all discharges are greenish or yellow greenish, and there is a fishy smell. Aggravation, cold, dampness, rain, thunderstorm, thinking of disease, and daytime aggravation. So daytime aggravation is characteristics of psychosis. And relief by movement, relief by lying on abdomen and stretching. Please keep in mind, the relief by movement, relief lying on abdomen, relief by stretching are psychotic symptoms. So these are all the in general psychotic symptoms. Now about the syphilitic symptoms. In case of syphilis, you will get less subjective symptoms. Very important point. In case of SORA, they will go on giving lots of symptoms having no pathological basis. But in case of syphilis, in case of mine, subjective symptoms are very less. Patient is dull, stupid, idiot, imbecile, suspicious, close-mouthed fellow, keeps his troubles himself. Patient is impulsive, mistrustful. You cannot depend on a syphilitic friend. You cannot believe on him what he will do. So be careful to do friendship with a syphilitic friend or syphilitic person, mistrustful, fixed moods and ideas which no amount of reasoning will remove, slow in action, in contrast to Sora, which is very active, extreme type of criminal sadist. The criminals, they are the syphilitic minded. Again, syphilis and psychosis is mixed, they will be the most criminal person in the world. So extreme type of criminal sadist, mental troubles relieved by the breaking of out of an ulcer and hemorrhage. Yes, abnormal discharges relieved, mental troubles. As regards physical general diseases associated with ulceration and destruction of tissue, destruction and ulceration is syphilitic. What parts are most usually affected? The periosteum and long bones are especially affected. The complaints aggravation at night and at the approach of storms. So night aggravation and the approach of storm is a syphilitic symptom. Complaints aggravation in summer, relief in winter. I've seen many asthma patients not suffers from winter, but in summer, that means they are syphilitic. Relief in winter. Always feels better in mountain. The patient goes to mountainian area, any mountain area, the patient feels better. Cannot bear either heat or cold. Patient neither heat, extremes of heat, extreme of cold, they are intolerable. They are ambithermal. Desires cold food, aversion to meat. Pain relieved by cold, syphilitic. So these are all the syphilitic symptoms, secondary manifestations. Now, so far I have discussed the theoretical aspects of the miasm, how they are manifested in the through primary stage, in the latent state, and in the secondary manifestation. Gradually, I will switch over to apply that knowledge in our clinical settings. Now, please try to understand the first thing. A person which comes to you may have a miasm, and that miasm may be developed from two sources. One, whatever he or she inherits from the parents, inherited hereditary transmission. So that is the inherited component of miasm. And that leads to the development of a susceptible constitution in a child. That means whenever a child born, he inherits certain miasms from both parents in the latent form. So according to that miasmatic latency, the patient develops different abnormal susceptibility. So child having some miasmatic background becomes susceptible to different diseases, different situations, different environmental factors, depending upon the inherited miasmatic status. Okay? Now, the child, during the journey of his life, when reached to the adulthood, he may also acquire certain miasms like soda, like syphilis, like psychosis, but he has to suffer from primary manifestations, latent state, and secondary manifestations. So, an adult person during his lifetime have its own mathematic background depending on the inherited component as well as the acquired component. And depending on that, the person's susceptibility, the symptoms varies. So, one person having the miasm inherited from the parents, acquired by himself, determines the different symptom manifestations while suffering from the same disease. I can give one example. A patient may have bronchial asthma, but the sodic bronchial asthma, the syphilitic bronchial asthma, and the psychotic bronchial asthma will be different. So we have to prescribe not only on the basis of the totality of the symptoms, but also the miasm behind. If you go through the Hahnemannian organon of medicines, initially Hahnemann told that the totality of the symptoms is the basis of homeopathic prescription. But if you go through the organon of medicine, followed by chronic diseases, Hahnemann told that what is the reason behind the totality? The cause behind the totality is the miasm. So, in curative homeopathic prescription, you have to cover the totality of the symptoms along with the causative miasm. Then and then you can cure. So, please keep in mind, whenever a patient comes to us suffering from some disease, the patient has certain miasmatic background inherited from the parents. He acquired some part during his lifetime, and accordingly, the symptom pictures differs. So, during homeopathic case taking, we have to take the case fully, and that full case taking, starting from the present complaints, history of present complaints, past history, family history, personal history, homeopathic generalities, are all nothing but the picture of the patient as a whole, and also it gives an idea about the miasm behind. So, in our homeopathic prescription, we need to find out the totality of the symptoms in that particular case, along with the miasmatic background. And in the selection of the medicine, we have to cover both so that we can prescribe a curative homeopathic remedy. So this is, in nutshell, the background, theoretical background of the knowledge of miasm. Now, with this theoretical knowledge of miasm, in the next day onwards, I will discuss how to apply this theoretical knowledge in clinical practice by giving at first by theoretically, and then I will discuss several cases where we apply this particular knowledge in clinical field and we get the result. So with this, I finish today's discussion. If you have any question, we can discuss. We have some time. We may discuss. If you have any question in your mind, we can discuss.
Thank you, sir. Thank you, sir, for your precise information. If anyone has any queries, please ask. Please raise your hand.
Actually, I cannot see. You have to say what's the question.
Okay. If anyone has questions, please write it down in the chat. chat box. Or maybe right. Like nobody has query.
Hello.
Hello. As there are no queries regarding. Everyone has understand your session.
I cannot hear anything.
Yes, sir.
Yes.
Anyone has questions? Please ask. Raise your hand and the
Someone is
chat.
talking, but I cannot understand. It is not clear. Any question?
Please write it down in the question and answer section. Please write it down in the question answer section.
No. I just see the only this screen, my slides. Nothing is coming into me. Nothing is coming to me. Just to see that only the screen.
Sir, I am fixing this.
So one thing you do.
Subham Kumar
Yes.
raised his hand.
What's the question?
Ask if
You read out the
Subham
question.
Kumar is asking. Yes, sir. Subham Kumar is asking, sir, if person is born with a miasm, then it can't be removed completely. If a person is born with miasm, then it can't be removed permanently. Is it true, sir? He's asking.
Yes, you cannot. You see, every man is solid, so you cannot totally, completely cure. That I can discuss on that day. Cured means, what does it mean? Health. Health is an apparent health. We can regain its apparent healthy condition. So true cure, that means no one will suffer, not any day. No. The miasm is also responsible for susceptibility. So that disease to healthy condition, that we divide that. But if it is something which is genetic disease, that cannot be cured. You understand my point? We can discuss what is genetic disease, what is inherited disease. Inherited means that part which is inherited, that cannot be changed. But the acquired part, that can be changed.
Okay.
Okay.
So you are getting Subham
Hello.
Kumar.
Hello.
Thank you, sir. He get it.
Any question?
Any other one who have queries? No, sir. No one is here. Thank you, sir, for this precious session, and we will meet in the next session. Thank you so much, sir.
Okay. Next, I'll give clinical application of this theoretical knowledge in the clinical practice. Okay.
Okay, okay, sir. Okay,
Okay.
okay, sir.
Or another thing.
Thank you so
Hello.
much, sir.
Another thing you can do.
Ji, sir.
You can do that if there is
Yes,
any
sir.
further question, you can send through the
Ji.
WhatsApp to me. I can discuss in the
Okay,
next class or next lecture. That will be
okay,
better.
okay, sir.
That if you have any other
Okay,
question, you can send to me WhatsApp so that we can discuss next week. Okay.
okay, sir. Okay, sir. Thank you, sir.
Thank you. Thank you all.